the line now, and we are live on Facebook. So if you go to my page, Opoku Opari, or you can go to the HRB Breakfast page, which I'm going to share on there right now, and also on the Sunday Best page, and of course on Dr. Seshni Mudlia's page, Seshni Mudlia. And there we go. So good morning and welcome. Entering the United Kingdom, it says that travelers entering the UK are said to be tested for coronavirus a few days after they arrive. Yes. So even though they will need a negative test to come in, after a few days they will be retested. And I personally think it's a very good thing to do.
Yes.
To make sure that there's no spread really.
Yes.
And then they also will have to quarantine for 10 days.
Yes. So yes, that's the news. Yes. So that's quite good, I think, in terms of actually controlling the spread of coronavirus, because we know the numbers obviously as it stands today, even it's still unpredictable as to how we're going to progress. So it's important that we do reduce the spread of coronavirus, and this is one way of the government reducing the spread, is having this isolation or quarantine measures in place and having a negative testing. So it's something which I think most people are willing to do anyway and are very much aware of. I was speaking to a few people and who were asking me some questions, as I always get, and one of the questions was about this quarantining and isolation. And the most of them felt that, when they were factoring in going on a holiday, because of this knowledge of knowing this, obviously it impacted on their travel plans. So no doubt it will impact on people's travel plans, and obviously work leave or leave, whatever leave they have, and family arrangements. So people would need to be aware that before traveling, they would need to adhere to these rules.
This is fantastic. And, it's happening everywhere. In South Africa, for example, I just read yesterday as well that it's probably the same thing happening there. They have closed their borders to a lot of the countries.
Yeah.
Those who will be able to get them will have to go through the same sort of situation.
Yeah. Exactly. So South Africa, we know South Africa, Ghana, Dubai, USA, a lot of these countries already had travel arrangements in place. So, but yes, they are getting more and more stricter. South Africa as well, because of the variant. The variant is coming a lot in the news. And yesterday I was quite not surprised, but I was a bit, I'm not sure about the news, but I don't know if you read, but we'll talk about the variant. So the variants obviously have a role to play in terms of the travel arrangements. So because of the UK variant, the Brazil variant, and the South African variant, it's affecting a lot of the travel plans. Because a few weeks ago, when we first heard about the South African variant and the UK variant, we saw that countries started to even stop people from Britain going into other countries. And likewise with South Africa, the borders to South Africa was closed and travel to South Africa was closed. Having said that, people are still able to travel. I had a cousin who had to go for my uncle's funeral last week, and he was able to go. So, but he didn't go for the funeral. He managed to still get there on the Sunday, but he had to go through the whole process of getting the testing and obviously going via different routes. So people are still traveling, but obviously, if they really need to, absolutely essential travel. And like that, a funeral is obviously a family emergency. So that was
Right.
obviously
Okay.
needed.
Okay.
Just, I wanted to say about the
Now,
variants, just to say about the variants of Boko, what I was reading yesterday, which is impacting everything, I guess, and even us going out of lockdown on the 15th, we'll only know on the 15th of Feb what's happening. But what I've read is they're saying that the vaccine, the Oxford AstraZeneca vaccine, might not be that effective against.
well, that's exactly the question I was about to ask you.
Yeah,
That's
yeah,
exactly what I was about to ask you about,
okay,
especially with the South African variant.
yes,
Talking about the fact that the Oxford AstraZeneca vaccine might not be as might not be effective to control or to, as it were, help
yeah,
with the situation. Now,
yeah,
and also because of that, South Africa has paused. They've paused giving out the Oxford AstraZeneca vaccine.
yeah,
They've stopped the vaccination for some time.
yeah,
So I was just about to ask you the same question when you started. Now,
yeah.
so what is the situation at the moment?
Yeah, so that's what I was saying. I was reading this last night in preparation for today, as I do, because I know I'm going to be asked these really good questions. But Apoku, that's surprising for me, to be honest. That this is what we're hearing, because we knew very early on when we spoke about the BioNTech vaccine, the Pfizer, the AstraZeneca Oxford vaccine, as well as Moderna. What we were told from the information very early on is that it was going to be effective against coronavirus, the SARS-CoV-2, the variant, the initial variant, as well as the other variants. So yesterday when I read it, I was really surprised that this is now the news.
Yeah.
So, it seems that obviously scientists, and they've done some studies, and the information that they have at hand is saying that the South African variant is obviously seems to be transmitting much more faster and also causing more deaths. And as a result, what they're saying is that the AstraZeneca, the Oxford vaccine, might not be effective. I think there was figures like 25%, if I'm correct, is what I read last night.
Yeah.
So I will have to
Yeah.
recheck again, but I was
Yeah.
quite surprised, and I said, I was going to message you actually and send you the article, but it was like just before midnight. So I thought you might be in bed. But it was just, yeah, shocking to
No, I'd
see.
seen it already. I saw it.
Yeah. So I
Yeah, I
don't know
wasn't
what you
there,
make
though.
of it. I don't know what you make of it, because actually a lot
I
of
don't.
the people, can I just say that apologies, I know you
Yeah.
wanted to talk, but a lot of people have been feeling more comfortable
No,
because of,
just go on.
yeah, because of the allergic reactions, possible allergic reactions to the Pfizer, which happened very early on. A lot of people felt that going on the Oxford AstraZeneca vaccine, taking that one was much safer. And I know lots of conversations I've had with people, and that was the actual understanding. So I don't know how this is going to impact now, because we know that the South African variant is still very much real, and it is spreading in the UK. I've seen articles where people have died in England. They've reported at least 10 to 30 deaths as a result of the South African variant in various places in England. So this is obviously going to impact on those cases and those areas. So how the government is going to handle it would be interesting to hear, because we also heard very early on where they wanted to combine the Pfizer and the Oxford and all the different vaccines. They said that the studies showed that giving a combination of these vaccines are going to prove effective and reduce transmission, which is what we want. So yeah, go on to you, Apoku. What's your thoughts about this news? Was it as surprising as it was for me to hear it yesterday?
It was very surprising, and what also moved, what really I was a bit concerned about was the fact that yesterday I really searched the news, researched what's going on, what's happening with to hearing that it will not be as effective as we think it is going to be.
Yeah.
And I realized that a lot of people are sort of not sure anymore.
Yeah.
They don't, even here in the United Kingdom, people are saying, oh, well, maybe the Oxford AstraZeneca vaccine is is, for the lack of a better phrase, is a lie. Like, it's not what we think it is, and maybe I will not go for that vaccine. If I have to get vaccine, I'll go for the other one. So that's not nice. That's not good.
Yeah, but
that's
that's
good news, because
that's
putting.
Yeah, I mean, exactly. I think that is not good at all. Just to say, yeah, I mean, that was surprising to me because, as I pointed out as well, a lot of people were keen to take the Oxford AstraZeneca, and even if like people had to choose, they were actually choosing to take the Oxford vaccine. They were waiting for that before they actually considered taking vaccines. So this is obviously a surprise. We'll obviously hear more news later on as to the impact of the different vaccines and its effect on the variant. So we know that they did promise and they did assure us, the scientists and the evidence, that any of the vaccines were effective against the SARS-CoV-2 strain or the other variants, the South African, UK, and Brazilian variant. But like we said, people and countries are now reconsidering, with this information at hand, that the Oxford vaccine might not be effective as we thought initially, in terms of the coronavirus and the variant, specifically the South African variant. We will hear more about that. And it's obviously going to impact on the changes and the decisions that people are going to make in terms of taking the vaccine, which I'm not surprised about.
I just pulled up that story that it was on yesterday.
Yeah.
Unfortunately, we were not able to discuss it when here. And
yes,
but if you don't mind me reading it for a second or so. So South Africa has put its rollout of the Oxford AstraZeneca vaccine on hold after a study showed disappointing results against its new COVID variant. Now, scientists say the variant accounts for 90% of new COVID cases in South Africa. Okay, and the trial, involving some 2,000 people, found that the vaccine offered minimal protection against mild and moderate cases. But experts are hopeful that the vaccine will start to be effective at preventing severe cases. South Africa has, then it goes on to tell us how many cases there are in South Africa and all that.
Yeah.
And so, on Monday, the World Health Organization warned against jumping to conclusions about the efficacy of COVID vaccines. But at the same time, whether we like it or not, it's very disappointing.
It is
very disappointing news.
It is. I can see how disappointing.
A lot of people had a lot of hope and trust in particularly the Oxford AstraZeneca vaccine, and then we hear these. And don't forget that the South African variant is spreading quite quickly all around the world.
Exactly. I do understand what you're saying, and I do absolutely 100% support what you're saying, because yes, the conversations, over dozens of conversations I've had with people, healthcare workers, my colleagues and friends all over the world, doctors and nurses and family members, everyone had been obviously hoping that the AstraZeneca, the Oxford vaccine, was going to be the vaccine of choice over Pfizer. But as it stands, yes, you're right, it is disappointing news. I think that's probably the word I wanted to say earlier. I was surprised. My initial reaction was very, very much a surprise.
Yeah, me too.
Like, I was surprised, I was shocked, and then obviously, I think it translates to being disappointed. Disappointment. Yeah, that's the word I was looking for, because like how we are feeling, Apoku, like how you've just explained your feelings, exactly the same with lots of people around the world, just not in South Africa and UK. Because I had people even asking me to send them doses of the Oxford vaccine to USA. So, people were really backing it.
Oh, really?
Yeah. So, so, as if I've got a supply, which I don't. But, it was just the fact that is how much. I was just using that as an example, because that was the extent of what people actually felt. Even though they in America, they wanted the Oxford vaccine, or they were in South Africa, they wanted the Oxford vaccine. So let's see how it, you know, the how it how we what happens next. I think that's all we can do, and obviously hope that the vaccines, more and more research will be done, and hopefully the South African variant, as they are saying, hopefully it doesn't spread as much. I mean, we are seeing good news in the UK. The figures have gone down. So we've seen about 14,000 people in the last 24 hours testing positive, and we've had 333 deaths. So the numbers, the figures have gone down, and that's obviously the headlines is that 333 people have obviously died because of the virus in the UK, unfortunately. But the numbers have reduced significantly if we think about the daily toll of like 1,300, 1,500 that have died. And so I mean, we've had about, I think, is it 1.2 million people that have been vaccinated, so quite a large number. It's either 1.2 to 2 million that have been vaccinated, so in the UK. So we are seeing that hopefully with the vaccination, and it seems promising that we are seeing the number of deaths reducing, which I'm so pleased about. To be honest, today I'm a bit pleased of being able to report on the numbers, even though every life matters and it is still a concern if people are dying, but at least the numbers are going down, which is reassuring.
Right. Okay. This thing I just want to put there. You know, this I had something. I was speaking to friends in Ghana yesterday, and from a very reliable source, this information I'm about to put out there, and it's just by the way, really, it's not really a matter of it doesn't really, but it's still a COVID story. So I'm just going to put it out there. I was speaking to a friend of mine, and she said to me that the people in Ghana, for example, because their vaccines haven't got, the Ghana government is going to get some vaccines anyway, but they don't have it yet. Ghana doesn't have it yet. But there are people in Ghana who are actually traveling to Dubai and booking themselves into a hotel for a couple of weeks or 3 weeks, and just for them to get the vaccine and then go back to Ghana. And it was a bit surprising to me, but at the same time, I was thinking, well, if they want the vaccine and they're in a hurry to get it, at least it helps the country, doesn't it?
Exactly.
You know?
Yes.
So I just thought I'd just tell you this story here, you know.
And I'm not surprised.
Then again, the question I want to ask.
Yeah, go on.
Yeah, the question I want to ask is, what is we might not know though, but what is the vaccination situation in Dubai? Are they just giving them out, you know, anybody goes and you get, just like they're doing in Israel?
Well, I didn't realize that it was like that. It's probably that people that are going to these countries obviously have other family members or friends in Dubai. I know Dubai, obviously, they are, what the Dubai, I think, was it one of their leaders, was one of the first to get the vaccines. And we seen pictures of it very early on, in December, I think, early as beginning of December. So Dubai obviously has access to the vaccines as well as other countries. So I would assume that it might be available privately. So lots of countries, and even in the UK, they will probably be distributing it privately as well. So people obviously that like how they started with the testing, doing it privately. So people that obviously have funds and are able to travel and pay for the vaccine, and will be obviously top priority in terms of the private sector. So as much as we are be able to get the vaccine on the NHS or the health system here in the UK and other countries, and like South Africa, even they've got that electronic system, the EVDS. So what's going to happen is obviously people would, like Ghana, the story that you told me is not surprising, because that's probably happening all over the world. People that are more the rich and the elite and influential people, if they have the money, they would be able to pay for it and get the vaccine privately. Yeah. Can I say, I do like
in a country like Israel, for example.
You go on. Sorry.
I'm saying that in a country like Israel, for example,
Yeah.
it's not, they give it to anybody who wants it. I mean, well, of course, when they started, it was just the health workers. But now, whatever the age, I mean, as long as you want it, you can get it.
Yeah.
Okay. Right. So we move on. Or did you want to say something?
I just wanted to say I love your screen, and I'm going to probably copy you because that's a screen I've seen and I've liked, and I'm probably going to do the same. It looks so good. I love it. It's for the global update, and so nice. Thank you. That's all I wanted to say. I've got the numbers out, Opoku. Unless there's anything else, I've got the numbers.
So okay. So let's do the numbers.
Yeah, so Worldometer 9th of February, the update today, 9th of February 2021. So we've got hopefully this is the accurate numbers that I've got. I did refresh my page. So it's 107,019,170 positive cases globally. Deaths are 2,336,650 deaths globally, and total recovered is 78,887,385. And in terms of the top 5 countries, we have USA number 1 with 27,700,629 positive cases, with 476,405 deaths. I think the 27 million for me just seems like a really large number in one country, because that's like miles away.
It's a large number.
Yeah, it's miles away from the second in the world, which is India, with 10,847,790 positive cases, with 155,195 deaths. Brazil number 3 with 9,550,301, with 232,248 deaths. Russia number 4 with 3,983,000 with 197, with 77,068 deaths. So still quite large numbers. And UK number 5 with 3 million. So just UK is probably very close to Russia, as we said. I'm just looking at the figures. So UK is 3,959,784 positive cases, with 112,798 deaths. And then looking at South Africa, we have is number 15 with 1,477,511 positive cases, with 46,473 deaths. And we've got Ghana quite low down. I've just seen something on Kenya which I wanted to talk about, but we'll come back to that. Ghana, we've just got 72,328 positive cases, with 472 deaths. And I'm just going to go to Kenya because there was some news on Kenya which just reminded me about this that I wanted to say. So the news was about Kenya. I'm still looking for it. Can you? I think I've gone past it. I'm just going to go back.
I'm looking for it, but I haven't found
Kenya's number 81 with 100 and it's 81 with 101,900.
Number 81, did you say?
Yeah, Kenya's 81 with 101,944 and 1,786. We'll talk about Kenya now, but just UK 24 hours figure. As I said earlier, we've had 333 deaths in the last 24 hours, which is significantly reduced, which is I'm so grateful for, and I'm sure you are, and with 14,104 positive cases. So Kenya, what I wanted to say, Opoku, I'm not sure if you've seen, but there were some British soldiers which have tested positive at an outbreak in a camp in Kenya, and they've been treated in hospital in Kenya.
I haven't seen that news
Yes,
yet.
so I read that last
Okay.
night. So that was quite interesting for me to read about that, and obviously because it's to do with Britain, it's not actually certain which variant of the COVID-19 they have. But as you've seen, that Kenya is quite low down on the list in terms of the virus. I mean, it's 81 in the world. So I was quite surprised actually to see, that this was actually the news. But that's exactly what they've said in terms of the news. I will get it up now, but that was an article that I read yesterday, which obviously caught my eye. So they said 4 British soldiers, from Sky News, 4 British soldiers taken to hospital in Kenya with coronavirus. So they've said that, and this was a news that came out yesterday, actually late last night it came out. So the MOD, the Ministry of Defense, confirms that 320 men and women are in enhanced isolation, and some have been forced to live under biovac tents for 10 days. So a number of British soldiers in Kenya have been taken to hospitals suffering from COVID-19 after an outbreak of the virus at the training camp in the country. So they were taken to Nairobi to the Aga Khan Hospital for medical treatment. So 2 of them were airlifted and 4 were driven by ambulance facility. So it's actually obviously not certain what has happened, but they are concerned of a spread. So how this has happened, we don't know. We'll obviously wait for more news, but they will obviously have to have testing and be in isolation now, which is what's happening. So it's not certain whether they had just come from UK and went into the camp, because usually what they're saying is they would have had to have, so soldiers must isolate in barracks before they leave the UK, and a negative PCR test is required 92 hours before deployment. So obviously they would have been tested, and they would have received negative testing before they got in, but we don't know anything more about the situation. But what Alfie Usher from the military website Forces Compare told Sky News, he said, "We've been comparing more and more soldiers deeply worried about catching COVID-19 and concerned that protocol isn't being followed." So it seems obviously this is really a concern in terms of the soldiers and the outbreak. So I'm hoping that obviously they will be looking at their measures and making more stricter measures in terms of the testing and obviously controlling the spread. They said another flight with 150 more soldiers landed in Kenya on Monday evening despite the outbreak in the camp. So the Kenyan government has been debriefed about the situation. So I don't know what your thoughts on that, but it's obviously, reading that for me was a bit worrying actually. So about the concerns.
Yeah, I haven't really got any thoughts on that. I'm just hearing it for the first time.
Yeah.
So I just think I have confidence in I think the authorities are going to do the right thing.
Yes,
so
it sounds like
28
it.
minutes past 7 here.
Yeah.
And before we go, there's a story that is not COVID related, but it's health related. It's a quick one. I just want to throw that in. But our health officials in the Democratic Republic of Congo have started tracing those who came into contact with the patient who died from Ebola. Well, they're doing track and trace Ebola now in the Congo. The 42-year-old woman died last Wednesday in North Kivu province, just after developing symptoms of the disease. But a team of epidemiologists are on the ground investigating the case, and authorities have announced that the disinfection of the sites visited by the patient was underway. So it's a good thing that, because of COVID, what's it called again? Track and trace.
Track and trace, yeah.
It's moved, the system from the COVID situation has moved on to the Ebola situation as well, and I think it's a good thing.
Yes.
People can be track and trace.
It is definitely. That's fantastic news. And that's amazing that
It
the
is.
Congo has actually moved in that system, which is fantastic news, especially to, I mean, they've seen that it's worked with the COVID and obviously, you know, to reduce
Yeah,
the number of deaths. I mean, it's unfortunate she sounded quite a young lady that still passed away from Ebola, despite us having treatments
yeah,
available, you know. So hopefully, yes,
yeah.
the track and trace will work. So thank you so much, Apoko. It's been
Right.
fantastic again. Obviously,
Yeah.
with lockdown, we
And
will
thank
only
you.
know the update of lockdown on the 15th when the government will relook at it. So as it stands, we still don't have information. People are still asking what's happening about the lockdown, but we yet
Mm.
don't have any information on any update. So fingers crossed on the
I have
15th.
I have a I have a very good feeling, Dr. Seshni. I have a very good feeling. I might be wrong though, but I have a feeling that things are going to get really, really good
Yes.
starting March, and we're going to go back to, well, not normal. It can't be normal anymore, but
Yeah.
shops are going to open and all that, and of course with the vaccination rollout, a lot of more people, more people are getting vaccinated and all that. I have this feeling somewhere in the back of my brain or my mind that we're getting there. It's gonna be good.
I think so.
We
And
can only hope, though.
I can see you
Yeah,
smiling.
yeah,
Yes, I'm definitely also positive. I feel the same. It's definitely like today here, you know, the news of the figures definitely shows a lot of promise and that things are
yeah.
working in the right direction. So hopefully a year on, it's hopefully looking more promising for everyone globally. So thank you again. Have a fantastic day. Blessings to you and your family. And guys, let's spread the love and not the virus. And wear a mask and wash your hands
Thank you very much.
and socially distance. Thank you so much,
Absolutely. Keep
Apoko.
safe. Keep safe.
Keep safe.
Thank you
Thank
very much,
you.
Dr. Session. My love to your family and everybody. Right, okay.
Thanks so much, everyone, for joining. That was a Hospital Radio update with me and with Apoko Opare on Hospital Radio Bedford. Do drop me a line or message and let me know if you have any questions. And guys, stay tuned for a jam-packed session with me, Seshni, at the Happy Doctor's Kitchen, where I will be cooking some happy and healthy meals. Namaste, guys, and lots of love from my family to yours.